Our electronic medical record system here. The Lifespan IT network has been duplicated at this site, so we'll have access to all the phones, voice over IP, and all of the functionality of the electronic medical record. This area also serves as other documentation. The nurses are able to see all the patients through the window, and some of the equipment is going to be in this area as well. And those are all still getting set up, as you can see.
So one of the benefits of using our electronic medical record is to be able to use computerized physician order entry for medications. The medication orders will be transmitted to the pharmacy that is on site. Pharmacy will verify the orders and release them to the nursing staff through the dispensing machines here on site. So nurses will be able to get access to medication that has been released by the pharmacy through these dispensing machines. And this is the same standard for medication administration that we're providing in our hospitals.
And nurses also have access to barcode scanners and readers. And these also allow for patient safety initiatives such as medication dispensing and identification of patients.
So we had mentioned that there were about 28 pods here. We have dedicated one of the pods. You'll see right before you get to the end of the row here as what we're calling a transition pod. Half of the transition pod will be used for patients who might need closer observation or more frequent vital signs. On the other half of that pod is an area for stretchers, and through the rolling doors that we can show you, we will have an ambulance on site at all times to be able to transport any patient who may need higher level of care or service at Rhode Island Hospital. We will also show you a designated resuscitation room in the event that there's a medical emergency and a patient needs to require assistance with breathing. And I think if you see it down there, it will be much easier for Dr. Suner to explain how we manage that. So this is our transition pod, very similar to every other pod for this half. The back half, like we said, has stretchers in case we need to move patients out. This pod will be staffed by emergency medicine physician and a nurse who is has critical care training, just in the event there's a higher level of monitoring needed while we make the transfer.
In designing this facility, we've put together some inclusion and exclusion criteria very carefully for the patients that would be in this facility. And that is to use our experiences with the hundreds of patients we've treated at Lifespan facilities to determine who deteriorates, because we know with this illness a certain percentage of patients will get worse over time. Many of them improve, but a small percentage do get worse. So we're trying to select those patients that will not get worse into this facility, but in the case that they do, we've designed this area so that we can accelerate their care and get them ready to be transferred back to a hospital. Since this facility is designed to take care of 600 patients, we anticipate in the case, it's a large number of patients, and these patients can have heart attacks, strokes, and in that case they would need acute resuscitation. And we designed this room to have, again, negative pressure and to be able to provide advanced monitoring and, if required, advanced airway management in this room while the ambulance is getting ready to take the patients to Rhode Island Hospital.
Did either of you happen to know what was in this room previously? Can I explain? Just curious.
This room was sort of like a, it was a concession room, right? Yeah, there's a kitchen in the back, and this room was hamburgers and French fries.
So I had mentioned earlier the designated areas of cool zones, which are clean, warm zones, which are, you know, considered infectious, where staff need to wear personal protective equipment. So one of the challenges we had to solve for was how you move material and supplies from cool zones to warm zones and maintain that movement without contaminating patients on either, staff on either side. So we designed the pharmacy, which is the last room down on the right, if you'd like to see it, where they actually built for us a pass-through in the wall. So the clean side of the pharmacy can place medications in that pass-through, and then on the warm side, pharmacy techs can take the medications and supplies from that area and get them distributed out to patients.
Did these folks already see that?
No.
Oh, well, yeah, I'd love to see it.
Yeah. I'll show you. So you notice there's more ductwork up here for the whole negative pressure system that was brought into the convention center. And we have started placing equipment and supplies in areas where staff would like them. We actually brought some of the nurses from Rhode Island Hospital who have been taking care of hospital-level COVID patients at Rhode Island Hospital for the last several weeks to help us set up the workflows and supplies to meet the needs of those patients. Kind of working in here, so part of our pharmacy team is in here. We created this little pass-through to be able to pass medications from the pharmacy in the cool side into the warm zone. And then this is the warm zone where our pharmacy techs will be to go and put supplies into the medication cabinets or bring specialized supplies out